Hi guys. Hey, welcome back to my channel. You guys know me, I'm Michelle. This is my best friend, Julie. Hi. We met in 1984.
Yes, in 1984.
Yeah, we were freshmen in high school in 1984. You guys know I'm 50, so is she.
Me too. Me first.
Doesn't look 50, this one right here, 50. So yeah, we're old. So Julie, as I have told you guys, is taking care of me tomorrow. She's taking me to the hospital for my surgery in T-minus 10 o'clock or like 6 hours, y'all. 7 hours?
7 hours.
Yeah, in like 7 hours we have to get up. I have to get my daughter up super early too. She's probably gonna be thrilled about that. I have to be at the hospital at 5:30. So I have my little hospital bag together. Ta-da! And Julie's gonna be taking care of me tomorrow and getting me home at some point tomorrow night. We don't know what time, but we'll be home at some point tomorrow. And she's also gonna be behind the camera at the hospital. She already knows the rules that she can film anything as long as I'm not naked and I'm not snoring. So there'll be no body parts hanging out, no drool, and no snoring. So she's gonna be able to take care of that. I got my new tripod set up. I got my new light in the background, so light looks better. During the course of the past 2 weeks, you guys haven't actually been able to see. I told y'all I'm tall, but I'm gonna get this on camera for posterity so that I can compare what I look like at this time next year. I'm a curvy girl, but I'm tall. She's taller than me. So I haven't actually gotten that on camera because you guys have only really seen me from here up. So tomorrow, surgery, we have to be there at 5:30. I have to take my anti-nausea medicine 2 hours before my surgery. I've got an alarm on and she'll make sure that I take it. And then my surgery is at 7:30. I've got to get there, get registered, pay for everything tomorrow at the new facility. So everything's gonna be fine, I'm sure. Hoping to be home sometime tomorrow night. They said observation can be anywhere from 12 to 23 hours. So hopefully we'll be out of there in like 12.
We'll keep you posted.
Yeah, we'll keep you posted. So Julie's gonna do some videos for me. I'm probably gonna look terrible tomorrow. I'm gonna look rough. I might be a little high and I'm okay with that if you guys see me like that, but I want you to kind of see the real thing and how it's gonna look. I'm gonna film as much as I can until I can get into the operating room, and then Julie will take care of everything while I'm in recovery and all that stuff. And then I'm hoping from some of the other videos I've seen with some of the other YouTubers that I'll be alert and around in a few hours after I'm in recovery and everything. So I'll talk to you guys about that. I've got my hospital bag packed, so I promised that I would talk to you guys a little bit about what's in here. I'm not being admitted for an overnight stay. Oh, that's Bear behind me. She loves the camera, so that's Bear. I think you guys have seen Stella's tail at one point. I have two cats. Bear's the sweet one, Stella's the challenging one. So I told y'all I got all my prescriptions from my doctor mailed to me. So I have my, this is really an antacid, my omeprazole that I'm taking with me. I have got my Zofran with me. I have the one in my purse that's a extended release that I'll take. This is the methocarbamol. This is for any abdominal cramping that I might have. And then this diclofenac sodium topical gel. I take diclofenac for my back. It's better sometimes than narcotics. It's a non-narcotic, but this will take care of the pain of the incisions and everything, and can be rubbed on that. So I've got my medicines in there. I already talked to you guys about GASTRIC, and I've got two different versions. Hold that one, Jules. Got two different versions. That's the liquid. I love her. And then I have the chewables, and the reason I explained to you guys from a clinical perspective, the reason that there is so much gas in your, anytime you have an abdominal surgery, no matter what type it is, especially if they're working on your intestines, which I have plenty of experience with abdominal surgeries. They are going to pump you full of air. And in the case of this surgery, they run a tube down into your stomach and they expand it full of air. So all your cavities are going to be full of air, and they expand that stomach to make sure that the staples are all in a row and that there's no leaks, no air leaking out of your stomach. And they make sure that everything's all together the way it's supposed to be. So that's why when you wake up, you feel like a Mack truck is sitting on your chest, and it's incredibly uncomfortable because it's gas pain. And walking helps get rid of that. So they'll have me up and walking probably within 30 minutes to an hour after I'm out of recovery, I would imagine.
I'll video that too.
Yeah, she'll video that too. I'm already clumsy with my MS, so I can't wait to see what walking looks like tomorrow. I need to pack some underwear because I'm not going to have you behind me like filming my hospital gown with my butt hanging out. So we're going to put some drawers in this bag. They're not in there right now.
That or we'll just block it out.
Right, so the gas X is really important. These are baby gas drops, and this is the exact same thing. Simethicone, this is 125 milligrams, and these are simethicone drops. They're exactly the same thing. Each little droplet, because it's a baby kind, is only 20 milligrams, so I can take 5 droplets of this, and I had a feeling that this liquid will go down better than trying to do a chewable right after surgery to break it up, and the liquid acts faster. So I got both of those. I got all your kind of normal stuff. You know, you look ratchet when you come out of surgery. So I have my brush. I'm bringing some, I'm bringing some face wipes so that I can like wash my face because it's gonna feel gross. Always, 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 always bring chapstick. And I have 3 different versions of chapstick. This was a little bag that Julie got me when we had our girls trip to New Orleans in March. So I'm using it for this too, and it's adorable. I used it for pool stuff too, but I have, this is my Mario Badescu chamomile and lavender spray for my face because your skin and everything's gonna be dry. Plus it smells like lavender, and hopefully I won't be super anxious, but we'll get, yeah, super relaxing. For lips, I have Vaseline Lip Therapy. This one's really thick, so I'm bringing this. I also brought a lip scrub. This is called Sugar Tart, and I get this at Sephora. It's a great little lip scrub. It's got oil in it. You just rub it into your lips, and then you can lick it off because it's sugar, and you just eat it, and it will like take care of your dry lips. I brought this CO Bigelow, this mint flavored CO Bigelow, because it's kind of more of an oily, you know what I mean. It's oily. Moisturizing. And then this I love. This is also CO Bigelow, and you can get this at Bath and Body Works. This is called My Favorite Night Balm, and I put this on my lips at night. I've noticed that my lips are a little dry though before this surgery. You know, I'm hydrating a whole bunch, but this liquid diet, it's even though I'm hydrated, I feel like my lips are drier. I can't go to the bathroom, so I'm taking care of that by tomorrow morning, thank goodness. You don't want to have any constipation going into this because you're already going to have enough gas as it is. All that built up in there, you don't want constipation on top of that. You will be miserable. So I'll be taking care of that tonight. But for your lips, I've got absolutely four different options here. So that makes a big difference. I'm kind of extra when it comes to like facial stuff, like face products and skincare products and makeup. She'll tell you I'm the makeup queen. You guys have seen me with makeup. You're seeing me without makeup. You're going to see me really without makeup tomorrow. But I have these little K-pop. These are Korean skincare, and this is actually made out of snails. It's actually pretty good. It's a moisturizer. This essence is called Time Revolution, and it's Korean also, but it's equivalent to SK2, which if you've ever seen the price of SK2 essence, it is extremely expensive, in the upper $200 mark. Yeah, this is exactly the same thing. Basically, it works just as well. Smells really good. These don't smell like snails. Let me just clarify that. The Super Aqua, this is a snail face wash, the same little kind. So I have my little travel pack. World Traveler over here. Julie also has a blog, Julie's Backpack.
Yes.
And she also has an Instagram, Julie's Backpack, as well. You can find
Julie's
her
Backpack.
there. She travels all over the world. She's been to Italy, she's been to London, she's been to Ireland, to Greece, Spain. She's been all over the place. But I'm also a little extra when it comes to designer things and handbags. So this is some Hermes shampoo and conditioner and soap that she brought me back. So can't afford the purse, but I can have these in my bag. One of my very favorite products that I have in here is my Luna sleeping oil. You can get this at Sephora. This stuff it's a retinol sleeping oil. This is the little baby sample that I got that sold me on it. It's very expensive, but this stuff lasts forever. And my bottle is like this big, and you only put like a few dots on your face at night. But I refilled my little glass sample bottle to take with me because I can't live without this stuff. And this is why when you see me in makeup, I don't look 50 because I take care of my skin. So
She
does
does.
she. Absolutely.
She should have a beauty vlog.
Maybe I'll turn my YouTube weight loss channel into a beauty channel
You'll
later
just
on down the
parlay into
line.
it.
We'll see. It's not like I would have any competition or anything on YouTube. I brought some Listerine Fresh Burst strips. These little things are great because I know my mouth's going to taste so gross tomorrow when I get out of surgery. And then Aveda. I'm a big fan of Aveda anything, shampoo, conditioner, but this is the Shampure composition oil, and it has the Shampure scent, which is my favorite. And I figured I could bring this and like dot it under my nose, or is there hair on it?
No.
It smells really good. I figured I could dot it under my nose.
Oh, yeah. I
I also have some lavender that I may throw in here, just in case the smells of the hospital aren't so great after surgery. So I'll dot that. I have Invisalign, and I'm not going to have it in tomorrow, obviously, but I bought these little preloaded toothbrushes. They already have toothpaste in them. When you wet them, you can brush your teeth. So I have some of those in there. And I have a little bit of makeup in here, not much. I'm not planning on like putting on a bunch of makeup or anything tomorrow. We'll see how good I feel. I don't do well without at least a little bit of makeup on, a little mascara and something on my lips, but yeah, we'll see how that goes. But this is also from Julie's Travels. Oh, I have deodorant in here, just little things that you think that you will probably need to like refresh, and I can use my facial wipes for my body and stuff like that because I'm not staying overnight in the hospital, so I'm not going to have the benefits of those little trays and stuff that they bring you, so I don't have to worry about that. In here I've got some eye moisturizer, bronzer. This is Natasha Denona, queen. Her eyeshadows and her makeup is amazing. Got the new Kat Von D little sample size mascara that I love. Every girl needs Chanel. Got my Chanel lip gloss in here. I have a little bit of everything. I even have a little bit of foundation, and I've got a nice little Sephora red lippy in here if I decide to get all glam tomorrow and if I feel good. Or maybe I'll just be high after surgery and feel like doing my face. I don't know. But I promised you guys I would show you what's in my bag. I'm not taking any pajamas or anything like that because I won't be there overnight. I am wearing, thanks honey, I'm wearing just some black leggings tomorrow and kind of a baggy plaid shirt, just something loose that I can put on after the surgery because you are going to be super swollen. The swelling in your abdomen, that's why they tell you to wear loose clothes, things that aren't going to be snug or tight. And then I told you guys I have to travel on Friday, so I went ahead and bought compression socks. I bought a compression garment. I said I wasn't going to do that, but I'm going to do it since I'm going to be traveling so that I don't have to carry a pillow with me on the plane. To me, that's gross. I'm not taking my pillow to the hospital. People that do that,
Just
I'm a nurse. Yeah, I'm not bringing any germs home to my own pillows. I know you can wash those things, but I don't care. We don't need any MRSA up in this house. No, so my own blanket, my own pillow, for those of you that like to do that, it's all good, but germs, I'm not a germaphobe, but I know what goes on in a hospital, so that's not going to happen. And then I'm just going to come home in the clothes that I wear tomorrow. So that's really about it. Just bring what makes you feel comfortable. If you want to bring a blanket and pillow from home, more power to you. That's just not my thing. But I don't want to have to travel with a pillow for compression, for pressure. So I went ahead and got that little belt. We'll see if it fits, because it's pretty dang snug. And with the swelling after surgery, let me tell y'all, I got two. I got the compression garment from CVS. So the real like surgical one, and then I got another compression garment from Kohl's, which is kind of like a corset, but you just pull it all in one thing, and it's stretchy. So if the Velcro one doesn't work, then I have a backup. It cost me $5. I can keep it, and I'll give it away with my bigger clothes once I start having to replace them with smaller clothes. We have a trip in October that we're taking. We graduated from high school in a tiny high school here in Texas with Anthony Lynn. He's the head coach of the Chargers. I don't know if Anthony will ever see this, but what's up? Hey Ray, we love you. We just saw him when he kicked off his Lynn Family Foundation just a couple of months ago, and Julie and I won a trip to Los Angeles. So Anthony is flying us out there, me and my daughter, Julie and her husband. She's married, guys. For anybody that's watching this, she's married. I'm not. So he's flying us out there. He's putting us up at the team hotel in Irvine. And we have sideline seats to the Chargers-Steelers game the weekend of October the 11th. So don't hate. By that time, I know I'm going to have to buy new clothes.
You
so,
look for us.
Yeah, maybe I'll find a new football husband. I'll be skinnier by then. We'll see what happens. But we have that trip coming up, and that's why I wanted to go ahead and get the surgery done and out of the way, get fully recovered, take care of myself, because we have stuff to do in LA. Taking the kid to Harry Potter World. She's already been. We're gonna go. We went year before last, on a girls trip, right? 2018.
Yeah,
year ago.
Mm-hmm.
So a little over a year ago, we were in LA. We went and we take a girls trip every year. We're friends with the guys in the band of the Psychedelic Furs, so we followed them to Austin. Last year we followed them to LA and saw them at the Troubadour on the Sunset Strip, which was amazing.
Very good.
It's a great show. So we got a chance to like do girl stuff and see the Walk of Fame and the Chinese theater, and to go see the Hollywood sign. We drove to Malibu, so we're gonna take her husband and my daughter to go see some of the things that we already had a chance to see on our girl trip. So thanks for tuning in tonight, you guys. As always, subscribe, turn your notifications on if you want to start seeing the real videos. The shit's going down tomorrow. It's gonna be the real surgery, the real stuff. It's gonna probably be a little ugly, but I promised you that I would be straightforward and forthcoming with you and try to explain things from a clinical perspective whenever I can. Disclaimer, I am not your doctor. So if you have questions, you need to call your physician and ask, but I will give you some clinical explanations from my own personal experience. And then I'll do a lot of what I eat in a day, and a lot of the videos that seem to be pretty successful on here. So here we go.
There we go.
We'll see you guys at some point tomorrow.
We will.
Night.
Night.
I have a new clicker. This is exciting. Night, guys.
Bye.
Subscribe. Turn your notifications on.